MAOI diet. What is a diet of a person taking monoamine oxidase inhibitors? Why would someone take MAOI? And it's basically because they have depressive symptoms. So, as an antidepressant drug, MAOI has a specific diet, and the diet primarily is no tyramine. You don't want to take any kind of food that has tyramine, and as I was told, it is any food that has that is fermented. But as you can see, we're going to show you it's like a little bit more detailed than just fermented foods. So high tyramine content food, as you can see with the three, things right there, increasing tyramine content. It says you must avoid while on MAOI drugs. Avoid at all costs. Aged cheeses, veggies, meaning fruits or veggies. I couldn't tell what a bean was. Red wine, never. Smoked and processed meats, other meats. Condiments, so I like to say, as I like to call them. So aged cheese, what kind of aged cheese? Cheddar. Cheddar is not always better. Swiss can get you dissed. Camembert, I don't know what kind of cheese that is. Blue cheese, Parmesan cheese, provolone cheese, Romano cheese, and Brie cheese. These are aged cheeses that you don't want to take because they have high tyramine content. Veggies, fruits or veggies. I wasn't sure what these were, so we're going to put raisins, fava beans, fava, not mother, but fava beans, and Italian beans, Italiano beans, flat Italian beans, no good. And the Chinese pea pods, Zhongwen, pea pods, do not take those. Those are veggies to avoid with high tyramine content. Also red wines. You don't want red wines because they'll make you, you can remember red as blood, bleeding. You don't want someone to die and bleed. No red. Chianti, whatever. Burgundy wine, Cabernet Sauvignon wine are all red wines to avoid because of high tyramine content. Smoked and processed meats, salami, bologna, summer sausage, and pepperoni. So salami, pepperoni, bologna, and summer sausage are smoked and processed meats who have high tyramine content. Other meats are, well, caviar is not really a meat, it's like fish eggs, but we'll throw it in there. Caviar, pickled herring, because you know how many Americans like pickled herring, right? I mean, who eats that, seriously? Corned beef, chicken or beef liver. I don't like beef liver, but chicken's pretty good to me. So those are meats to avoid high tyramine content. Condiments to avoid are soy sauce. So this is bad for Asian people. Brewer's yeast. Meat tenderizer called MSG. Again, Asian foods, MSG, soy sauce are condiments with high tyramine content. Another area that has tyramine are the medium tyramine content. That only has two little bars there. So medium tyramine content. You may eat occasionally while on MAOI therapy. So these are meats. Meats are meat extracts like bouillon when cooking, beef stew. Bouillon, you want to avoid that. But occasionally you can have it. Drinks. Beer. White wine. We said red wine was totally bad. White wine is okay, I guess, sometimes. You want to avoid coffee, colas, teas, and hot chocolate. So hot chocolate, you want to avoid that. Those are drinks. Fruits, you want to avoid avocados and bananas. Milk products, you want to avoid yogurt or sour cream. Those are meats you want to avoid. And then cheeses. Cheeses to avoid would be Gouda, processed American cheese, and mozzarella cheese. So these are cheese, or you can eat occasionally, but you don't want to eat all the time. Okay, so tyramine. Then they have low tyramine content, which are limited quantities are permissible while on MAOI therapy, and figs are, it's okay sometimes. pasteurized cheeses, which are cream cheese, cottage cheese, ricotta cheese. Sometimes you can have it. And distilled spirits. Distilled spirits, you can have those in moderation. So these are the diet of people taking MAOI, monoamine oxidase inhibitors.